1 week for implantation. 1 week for implantation. Now, folic acid, that's kind of important because remember, Christina, we don't have a storage of it. We don't have a storage of it. So folic acid. Ebony, who should be taking supplemental folic acid?
If you're thinking about considering being pregnant.
Very good, very good. So all female patients of reproductive years. Would you agree with that statement? So we'll superimpose it. All female patients of reproductive years who play. Accidents happen. It's called alcohol, but accidents happen. Yeah. And you're like, yeah, but alcohol has folate in it. Nice try. No. Right. No. Not going to work. All right. So folic acid should be taken at least a month before a couple tries to conceive. At least a month before a couple tries to conceive. Normal pregnancy, meaning no complications, no history of neural tube defect in the family, we just give her 1 milligram. But if mom's high risk, meaning she's on an anticonvulsant drug, a prior neural tube defect, or a first-degree relative with a neural tube defect, we now give her 4 milligrams. So we give her a higher dose. So I want to go back to this part right here. 1 week for implantation. So let's go on a little journey, a little drawing. All right, so let's start. Let me go ahead and put the ovary in this picture. The ovary. And the ovary has primordial follicles. Primordial follicles. And these primordial follicles, at least one of them will become a mature Graafian follicle. A mature Graafian follicle. Now, what's kind of important about that is that there are cells that surround this mature Graafian follicle. And there's 2 types of cells that surround that mature Graafian follicle. To the inside, the green are your granulosa cells. To the outside, the magenta are your theca cells. And what do your granulosa cells produce again?
LH?
Estrogen.
Estrogen.
Estrogen. So they give you a little cartoon and they have the primordial follicle and the cells are surrounding it and they have an arrow pointed to it. You know it's granulosa cells, or they'll ask you what it produces and you'll pick estrogen. Remember, the theca cells to the outside produce androgens. Now, in order to go from primordial follicles to mature Graafian follicle, this is known as prophase of meiosis 1. You're only developing 1, so we'll call it 1. So prophase of meiosis 1. Well, this journey will continue. This journey will continue. This journey will continue. And on day 14, the primordial follicle is released. The primordial follicle is released. But please be careful, because what stays behind are still the granulosa cells and the theca cells. They stay behind. They will involute. Once ovulation occurs on day 14, they will involute. And they're going to close off. They're going to close off like this. Now, when it does, we call this the corpus luteum. This is the corpus luteum. The corpus luteum. Hey, do you remember Dr. Nagel? How we did the average menstrual cycle was 0, 28 days? Mm-hmm. We said on day 14, wasn't that ovulation day? And we talked about an endocrine, this spike going up like this, and it was estrogen because of the autocrine function. Then we talked about how progesterone would go up, and then come back down. Yeah. And then we talked about that crazy surge that occurred called LH. and in one that went up but didn't go up as high. Wasn't that FSH? A little lower because of inhibin. Well, on day 14, if she ovulated, then what's climbing? Progesterone. So the corpus luteum is responsible for releasing progesterone. And it's going to prep the uterus for implantation. It's going to make it thicker. It's going to expand the spiral arteries until the placenta can take over, if implantation does occur. But if she's not pregnant by day 28, you know that whatever tissue that was grown is now going to slough off. And the corpus luteum will progress to scar tissue. And macrophages will consume that. And this is called the corpus albicans. And this is what happens in the ovaries every month. Every month. Okay? So what if I turn around and put a fallopian tube here with this cute little fimbriae? And we know the fimbriae move to entice the egg to be taken up through the tube. So let's turn around and say that she has a hot date. She's nervous. We'll put a little bow in her hair. She's nervous, very nervous, because they met online, and she doesn't know if he really looks like his profile picture. Mm-hmm. And she's going to travel. They have a hot date, and she's going to travel. She's going to travel because they agreed to meet at this restaurant called the Ampilla. And she's going to get all the way there, very nervous, not sure what to expect. Not sure what to expect. And before you know it, here he is. He has fought millions. Acid environments. Millions. In an area that's not conducive for life. We'll put a little bow tie on him. And they meet. They meet in this region known as the Ampilla region. And because they met here, isn't this called metaphase? And there's not one, but there's two of them, so it must be meiosis 2. Folks, if you want to study everything about polar split bodies and everything, that's nuts. Clear your head of that. There's only two things they test on, prophase and meiosis 1, because if you don't have that, you can't make a mature Graafian follicle. Metaphase and meiosis 2, if they don't meet, they'll never conceive. So these are the two they love to test on. All right, now, they meet. It's perfect. They're so happy. It's everything they've expected. Woo-hoo! Give them a little smile. We'll give her a smile. Oops. Oh, they're so happy. They're going to go on a honeymoon. They're going to go on a honeymoon. They're going to travel. They're going to go on a road trip. They're going on a honeymoon, and they're going to travel. And that road trip takes 5 to 7 days. 5 to 7 days. And in the endometrial tissue, there's all these spiral arteries that are just waiting for them. And when they travel all the way down, they're tired. They want to spend the night somewhere. So hopefully somebody left the light on for them. And now implantation occurs. And when implantation occurs, these syncytiotrophoblasts, I'll have it on the slide, the name, these syncytiotrophoblasts start digging into the wall. What is it looking for? Blood. See, it's a tumor like Dracula. It's looking for blood to suck life from the host. Now we have implantation.